Alright. I don't know if you can see, but we'll go over hypoxic drive now. Hypoxic drive. Okay. So pretty much, we're going to start from the beginning, so you can see. Let's see. Your lungs. You kind of go down like this. Pretty bad picture. But you have all inside, all your little alveoli, right? So, with a normal person, the oxygen is going to go into the alveoli, get picked up by the blood vessels, and then exchange the CO2 for the O2, and then breathe out, you exhale O2. So, it's going to go O2, CO2 this way, and this is going to go that way. And then we'll just put capillaries here, which is this is where the exchange happens, right? If your alveoli, here's your capillaries full of CO2, so the O2 goes here onto the red blood cells, and then the CO2 goes into the capillaries, and then you exhale, and then the CO2 goes out. That's for a normal person, right? And then the way somebody breathes when they have normal breathing is in your blood, the CO2 levels need to reach a certain point. So here's your red blood vessels. They give the tissues the O2. So we're going to give O2 to the tissues, and then CO2 is going to get loaded onto these red blood vessels. And then they're going to travel to the heart, then to the lungs, where this process is going to happen. Your body knows when to breathe because the CO2 in your blood gets really high. So CO2 is bad. This is toxic. When this CO2 gets high, it's like poison in your blood. So your body's like, oh shit, I need to breathe. So your body's gonna breathe when this gets high. Now, for people that have COPD, this is normal. This is normal. For people that have COPD, abnormal. It's not good. What happens is, in their lungs, we'll draw another lung, they have chronic issues with it, whether it be asthma or emphysema, it doesn't really matter. But here are your alveoli. We're just going to use emphysema as an example because it's a pretty good one. With emphysema, what happens is essentially you're going to kill all your alveoli because all the smoke inhalation is horrible for you. So you kill it, and now instead of having this efficient machine that has all these little options to exchange this gas, you only have a few. So what's going to happen is when all of this, the red blood cells come to exchange the gas, get rid of the CO2 and get like O2, oxygen, because that's the good stuff, there's not many options to drop it off. So what's going to happen is it's just going to retain all the CO2. It's going to pass by here. It's going to be like, oh, no CO2 can be dropped off, so I'm going to continue going. And then here, the ones that do get it, they're going to get obviously some oxygen, but not as much as these guys will. So what's going to happen is you're going to have chronic CO2 levels that are upwards, just due to they're not able to offload anymore. And then O2 levels are going to be pretty low. That's why they say when you put the pulse ox for people with COPD, that usually, let's see, COPD, SaO2, it's 88 is going to be like, if they have 88, it's going to be kind of normal for them. It's not abnormal. In a normal patient, this is a whack-ass number. You do not want this in a normal patient. But with COPD, you can get away with it because remember, they don't have enough alveoli for that exchange. So the O2 levels are going to be low and the CO2 levels are going to be high. Now, when it comes to the breathing, where hypoxic drive comes into play, remember how we said here that the body knows when to breathe because CO2 is high, right? In COPD, since it is always high, if the body still had this normal breathing pattern of the high CO2 to cue it to breathe, these people would be breathing like maniacs. It would be crazy. The body can't sustain that. So it switches to another type of breathing, like to drive it. So to cue your body to breathe, it's going to switch to low O2 levels. Since this number in of itself is now so just, it's no longer valid at all. It's like, it's just a bad reading. This is no longer accurate to what the body needs, because this is chronically high. For the rest of your life, you're going to be like this. So your body's like, oh shit, since this value is no longer good, I'm going to move over, we're going to cancel this out and move over to the low O2 value as well, lower than what's normal for this patient. Obviously this is low, but your body can still kind of survive with this. Not great, but it's functional. But let's say it gets down to like 70%, if it just keeps dropping, or like, this is horrible. This is really bad. So when it starts to drop, your body's going to be like, with hypoxic drive, of course, okay, CO2, we can no longer use, it's too high. O2 is what we're going to be using now. So when the O2 gets low in the bloodstream, right, that's when your body's going to be cued to breathe, because it's low. That's essentially what hypoxic drive is. So hypoxic means low oxygen. Drive is to do something, to cue it. So your body's being cued to breathe, to inhale, because it's low on oxygen, not because it's high O2. Because this is no longer a good value to use. So it's going to switch to the only other one it has, which is the O2 value. I hope that helps.